With the recent success of the Bernie Sanders campaign, I thought it was probably time to pay a little more attention to his plan for Social Security and Medicare. So in today's video, I want to lay out what we know so far about how his proposals will change these programs if he ends up being elected president. Now, as this presidential campaign develops, I fully intend to keep you informed about the various aspects of all the proposals. So if you're new here, be sure to subscribe and click that notifications bell so you'll be informed every time when I release a new video. Now, some of what we hear about all these proposals and changes is just hot air, and it'll never get worked into actual policy. But please keep in mind that within 16 years, the Social Security Trust Fund will be emptied unless something is done, and we're facing some sort of a cut in benefits. So what we're hearing coming today from the politicians is probably an indication of how they are thinking this problem can be fixed, and it gives us a glimpse of what types of changes we might be able to expect in the future. So what I don't want to do as we wade into this is to start coloring my analysis of what I'm taking in with all of my opinions. I want to present you with the facts and let you decide and discuss this down in the comment section. So don't be afraid to put your stuff down in the comments. I love to read those and sometimes get in and interact with those as well. So in today's video, I want to lay out the changes to Medicare, the changes to Social Security, and then talk about how he plans to pay for these changes. And you don't want to miss that part. It's pretty important. First, let's hit Medicare. So there's several key points listed on the BernieSanders.com website, but they really all say the same thing, and here's what it is. His plan would be to introduce Medicare for all. This would be a national health insurance program that would cover everyone. There would be no networks, no deductibles, no copays. They would also expand Medicare coverage to include dental, hearing, vision, long-term care, and prescription drugs as well. I'm going to tell you, a plan like this changes everything. Private health insurance companies really wouldn't be needed any longer and would most likely just go out of business. The pharmaceutical companies would probably see a drastic cut in profits as they would be forced to lower their prices dramatically because under this proposal, they could no longer sell their pharmaceuticals for a price over the average price in other developed countries. And then the fallout on healthcare providers like clinics and hospitals would be pretty severe as well, I would expect. Because currently, Medicare doesn't pay nearly as much as private health insurance for the identical care or procedures. So that would probably mean that hospitals and clinics would see a big decline in profits, and maybe even the overall pay structure for healthcare workers would also decline, maybe even dramatically. This plan is the equivalent of saying, healthcare in the US is a big mess. Let's burn it down and start over. Now, a lot of people like the idea of Medicare for all, and if you don't mind the government being in charge of your health care, it can seem to be a welcome relief from the screwed up mess we have today. But there are going to be a lot of losers if this happens. Now, the ones we know about now are those who are employed by an industry that would be hit by these changes, or those who have an income over certain thresholds, which we'll get to in just a little bit. And that's what we know about today. As this works itself through the system, there could certainly be some additional fallout. So now let's move on to the changes in Social Security. His changes to Social Security are not as far-reaching as they are for Medicare. This is not a burn it all down and start over type of approach. In fact, a lot of his suggested changes are shared by others in the Democratic Party. The first change is a benefit increase. He proposed increasing benefits across the board by $1,300 per year for individuals with incomes of less than $16,000. The second change is how the cost of living adjustments are calculated. So currently the Social Security Administration uses the CPIW, but there's another inflation measurement that isn't official, but the Bureau of Labor Statistics has been updating it for some time on an experimental basis, and it's called the CPIE, and it's meant to track expenses for households where at least one member is 62. And if you look at a comparison of these two measurements side by side, there are certain categories that are higher and more expensive for older Americans, which means that the CPIW, the current method, just isn't keeping up for expenses for older Americans. But the biggest change to Social Security is how he plans to raise the revenue to keep the trust fund solvent for the generations ahead. Now, his overall plan is to abolish or nearly abolish the maximum wage base. Currently, you pay Social Security taxes on the first $137,700 in wages or self-employment income. Amounts above that are not subject to Social Security taxes. But Senator Sanders' proposal has the tax kick back in when the income reaches $250,000. And because the current number is set to increase for annual changes in average wages, it would eventually close the gap between where it is now and $250,000, which means that eventually everyone would pay Social Security taxes on all of their income. But here's one key difference about his plan. This isn't just for wages like it is now. This would include all investment income, like dividends and capital gains as well, and it's not clear whether an individual would receive any credit to his or her Social Security benefit from the excess taxes they'll have to pay in. Now, I'd love to hear from you in the comments. Do you think the taxable cap should be eliminated? So that covers how he plans to keep Social Security solvent, but how does he plan to pay for Medicare for all? Well, depending on who you ask, the cost for this program will be varying degrees of very expensive. Bernie Sanders' campaign estimated that it would cost just under $14 trillion over a 10-year period, but the Urban Institute estimated the cost at $32 trillion over the same period. Either way, it's going to cost a lot. Just for reference, the Congressional Budget Office projects all federal spending over the next 10 years to be $44.8 trillion. This means that Medicare for all would be a 75% increase to the overall federal spending. And here's the highlights of how he plans to raise that sort of revenue. First, employers would have to pay a 7.5% payroll tax. Now, this is a payroll tax specific to Medicare for all. Individuals would have to pay a 4% income-based premium. Now, this would be in lieu of premiums they were paying before, so this wouldn't necessarily represent an increase for everyone. In addition to this payroll tax, there would be several brackets added to the federal income taxes. Now, currently, the top bracket for those who are married filing jointly is 37% if their income is $500,000 or greater. Now, under the Sanders tax plan, there would be 4 additional brackets added, taking the top bracket to 52%. The big twist here, again, is that all income would be counted and taxed at those rates. There would be no more separate tax rates for capital gains and dividends. Now, there's going to be a lot of other smaller changes that he's proposing, like bringing back the estate tax to the 2009 level, elimination of tax breaks for self-employed people with the S-corps, wealth tax, and a few other items worked in there. But the major changes are the payroll tax increases on employers and employees, and the increase to the federal tax brackets. Now, these increases are largely believed and reported to be aimed at high-income rich people. But if you check out the site bernietax.com, and I don't know that that's associated with his website. In fact, on the bottom it says it's not. I don't know if it's associated with a campaign or anything like that. But that site does tell a little different story, and I've linked that up below. You can go over there and check out the new income tax brackets and even plug in your income to see how your disposable income would change. Now, when I played around with this, it appears that a married person with more than $25,000 in joint annual income will see less disposable income as a result of these tax increases. Now, this is just a quick, summarized version of the Bernie Sanders plan, but as new details come out, I'm going to be sure to keep you informed. But before you go, I'd love to hear your thoughts on Medicare for All. Do you think we should switch over to a healthcare system like this? I look forward to reading your thoughts in the comments below. Thank you for watching. Have a great day.